Hi there, I got too excited when talking about Chapter 7, the skeleton, that I didn't get finished. So this is Chapter 7, Part 2, the skeleton, and we're going to look more at bones and joints. When I left you, we had just finished looking at the shoulder girdle. Please pay attention to what articulates with what. Then we talked about the arm, and here we have an example of a head. This is the head that goes into the shoulder joint, or the ball of the ball and socket joint. Now, when you look at the hand and the wrist, please realize that they all have distinct names. We just call them the wrist or the carpal bones and the metacarpal bones, but they have distinct names in it. Very easily to break your wrist because there's so many parts. When you look at the pelvic bones, you have the ilium, then you have the ischium, and the pubis. So the pelvis itself is really three bones fused together. Then, since this is the ball and socket, they call this socket the acetabulum, which is actually a vinegar bowl. I'm not sure why. But the head of the femur is actually a tuberosity, a very large head allowing it to rotate. And this is usually the problem when you have hip replacement. Notice here that these shows cartilage on it to help with the movement. We talked briefly about how females are wider, and that's for birthing. Good. We mentioned the word condyle as one of those vocabulary words you need to know. A condyle is a nice articulating surface, and they're usually quite kind of smooth, but yet rounded. Good. There are tumors of the bones. Notice you would have osteosarcomas is actually what Terry Fox died of. When it comes to infection, you have osteomyelitis and tuberculosis. Just to be aware of the name and associating the disease with the system is what we're looking at here. Now, with age, there are spinal changes, and actually with the advent of computers and texting, they say that the curve is gone out of the neck because we're too busy being hunched over. This affects the young. Normally, your spine should have a nice curve. It should be kind of a shape. Let me find that for you. A nice curve. There isn't a picture in this one. Anyway, you should have, this should be curved, and then this should, so this is the normal top here, and this is the normal bottom here. Okay. Fixed with chiropractic, where they are realigning the bones and the muscles. Good. I didn't get to talk about, one of the main things about bones is they are easily fractured. There's all sorts of names to go with the fracture, and it's all based on how clean the fracture is and if there's any complications on it. You just need to be aware there are many different types of fractures. At this course, you do not need to know them. Now, when you look at joints, joints are there to allow for movement. There are fibrous joints, which are immovable, and this is an example of the skull, the sutures in the skull bone, and they're very tightly put together in humans. So if you think, remember, we go back, in the infant, they're very open, but when you go to the adult, here we have our sutures quite tight, and that will allow for very limited movement in the adult. Good. Next type of joint. Whoops, not that one. Here we go. A cartilaginous joint. This is a joint where there is a limited amount of movement, and this is the pubic symphysis. the pubic symphysis. And the pubic symphysis is basically between the vertebral body. Now, in the hip, and this is often why women who, after they give birth, have a movement in this location right here. Here is the pubic symphysis. Where they join, there's a bit of cartilage. This can move slightly. Then the last type of joint is the synovial joint. And the synovial joint has quite a structure around it. And so here's the example of a synovial joint. You have a capsule with some fluid in it, and that's the synovial fluid. This helps lubricate the knee. Well, most joints most joints with great movability are synovial joints. So when you look at types of synovial joints, you have here's the ball and socket synovial joint, because you have a ball on the end of one and the socket in which it goes into. Then you have a hinge joint, and the knee and elbow moves quite well in one plane but not in others, and that is the hinge joint. Then there aren't other pictures of the others. There's a gliding joint, and that is the bones of the wrist. They glide over each other. Then you have a pivot joint, which an example is your neck because they rotate, and also an example is your wrist because the ends, the proximal ends of the radius and the ulna will rotate over each other. A condyle joint is between the metacarpals, right here. A saddle joint is between your thumb and your wrist. It moves pretty much like saddle. And then you have the ball and socket joint. The more movement you have, the less stable the joint. The hips and shoulders, not very stable, but you have great movement. Okay, when you look at different movements, there are words for different movements, and they're paired. Flex means to open, extend means to, flex means to close the joint, extend means to open the angle. Then you have adduction, which means to go away, abduction, circumduction, which is rounding, rotation, which is moving. To help you with all of these, here's a little diagram, and if you click on this link here, there's a little song to help you with them. In terms of disorders of the joint, I just want you to be aware of them. You have dislocations, you have sprains. Herniated disc means a disc move. Arthritis is a very common joint disease. You can have osteoarthritis, which is degeneration of the joint. You can have rheumatoid arthritis, which is the swelling. Then you can also have backache, which is common. So a herniated disc is when the disc, there's usually a cartilaginous disc between each vertebrae, and it will go out and it will pinch the nerve. Okay. Good. That is pretty much that. Please pay attention to the word parts. Osteo means bone, and then you have cartilaginous or condyle, or cartilage is clast means to break. Costa, like intercostal, is ribs. Supra is above. Spina or infa is below. Ab is away. Ad is toward. And that's enough of chapter 7. Please make sure you memorize, including the spelling of this diagram, and that will give you the bones that I want you to know. So this one here gives you all the bones that I want you to be aware of. And then there's a list on Blackboard of things like the xiphoid process. You need to know the acromion process at the end of your scapula, and a few other process, iliac crest. Anyway, there's a list. And that's it for chapter 7.